So welcome to today's It's Worth a Shot. We will be going over Transitions of Care Toolkit. Next slide, please. We did want to let you guys know that we decided to pause It's Worth a Shot for the July 5th session because that's coming right out of the holiday weekend, and we don't know if people will be taking time off or if people will need to recover from their 4th of July celebrations on July 5th. So we just want you to know that we will not be having a Worth a Shot on July 5th, and we will resume on July 12th, that following Wednesday. Next slide, please. All right, as always, we really appreciate your participation as coming to the webinar on a weekly basis. There will be an evaluation placed in the chat, and if you could fill that out, we'd really appreciate it because it helps give us ideas for topics and also lets us know if there's any questions that we might not have hit that we could answer for people and whatnot. We do have one polling question today. Mary, if you can cue that, then we'll go ahead and start it. Were you successful in entering your seasonal flu vaccine data into NHSN? I know there was a few changes this year, so we just kind of want to take the temperature on if there was any issues or not, which looks like there wasn't. So that's good to know. Oh, I spoke too soon. We'll give a couple more seconds for this to finish out. Okay, I'm going to go ahead and end the poll, share the results. Okay, can we go to the next slide, please? All right, I'm going to hand this over to my co-presenter, Lori, and she's going to go over the recent COVID information.
How are you guys doing today? I hope you're having a fabulous day. And I was excited to see those polling results. So 95% of you, I think that was the last number I saw, got your data entered for that NHSN with no problem. So congratulations. A very few of you have problems, it looks like, due to level 3 access that you got resolved. So I'm glad to hear that as well. So yay. With that being a new measure that was added as an annual requirement for long-term care reporting, it's good to hear that people were able to get that in without issues. So taking a brief look at our COVID-19 hospitalizations, deaths, and ER visits. So I am happy to say that things are continuing to trend down. Our hospitalizations are down, our deaths are down. You can see here in our graph, actually the deaths are down a really large percentage. So that is encouraging to hear. We do continue having admissions from our long-term cares into our hospitals each week. Also our vaccination rate. So for our percent of the booster rate, that is at 17%. And that, I would like to say, should go up. So please, as you're working with your staff and your residents and your patients and in your communities, please consider getting the bivalent booster and becoming up to date. That's a really important part of our package at protecting ourselves against COVID. And for a population our size in the world, there's only 5% of our population of the whole world, and yet 20% of the deaths from COVID have been in the US. So one of the ways we can help change that is to be vaccinated to help protect us from that. So next slide, please.
Lori, sorry, can you hear me?
I can.
Okay, so we did want to interject too. I know that we beat the vaccine horse beyond death, but recently our partners in Hawaii have had a bit of a COVID outbreak in the nursing homes, and we've gotten a few referrals for the hotspots. And we do want to say that, again, the vaccine does not prevent people from getting COVID, but it does help prevent the deaths. And so even though we've had some outbreaks recently in Hawaii, their uptake of the vaccine has been tremendous, and they're having very few complications with their COVID cases and a quicker rebound to health than what other places, you know, that have infections and they end up with hospitalizations, even possibly deaths. So just another plug in there, which I know we're tired of, but our partners did have a bit of an outbreak going on and have managed to successfully navigate it with no deaths reported so far.
Excellent. That's a really great point, Miranda. Thank you so much. Next slide, please. Okay, so here's just a look at the COVID-19 hospital admission levels from our CDC website. You'll remember that that we've transitioned to the use of that COVID data tracker. So it is a look at the vaccine confidence and the COVID VaxView all kind of put together there in the current methodology. So it looks not too bad, as you can see. That we've got some spots around the US that are kind of a little warmer, so to speak, than others. But in any case, please, as Miranda just mentioned, it's really good to keep all those items in your toolkit in ways to protect ourselves against COVID. It is still in our communities, and some more than others, such as in Hawaii, as Miranda just brought up. Next slide, please.
Lori, we have a question in chat. It says, any thoughts on giving the bivalent now and then pushing an updated version likely coming out in the fall?
That's a great question, Maria. Thank you for that. So honestly, we know the bivalent shot provides more protection than what those monovalent shots did in the past because they contain more current variants within them. And so they offer better protection. So I would say if someone is not up to date now, to go ahead and get that bivalent booster. Now, is there a potential that the vaccine will be updated at some point, i.e. later this fall, perhaps? Yes, there is, but I wouldn't wait. I waffled over this myself last year. Remember when we were going to that second booster kind of a stage? And I know I was convinced we were going to have another one come out last fall. And did I wait? And I was like, oh, I should wait. And I went ahead and got it. And I was glad because it gave me enough time that you had to wait in between the boosters for that next updated booster, which was the bivalent one to come out last fall. So I would encourage everyone to be up to date and get that bivalent booster as soon as possible. Because as a new vaccine comes out, an updated vaccine, perhaps later this fall, then there will have been enough time passed so that you can get the most up-to-date version. I hope that answers your question. So.
Yep, and it looks like
Great.
Kathy just checked in that our medical director suggested doing second dose in the fall for those who have had one bivalent dose already. So it looks like some people already have a plan, or some facilities already have a plan for even if a new variant of vaccine comes out, they're still on schedule to receive them.
Yeah, that is excellent. And that's great advice. So super. Okay, next slide, please. We're going to go ahead and talk briefly about the questions that we had from last week and get those answered for you. So our first question was actually related to the topic we just talked about, and that is, will there be a COVID-19 monovalent vaccine in the future? So the short answer to that is currently our COVID-19 vaccines are all bivalent, including protection from 2 of the COVID strains, the ancestral strain, which was the same formula as the original vaccines, and then the more recently circulating Omicron variants. So that is what's meant by a bivalent, and it offers better protection for you than the monovalent vaccines did. Next slide, please. Okay, and so a second question that was asked last week we wanted to answer for you is, any suggestions for a brand new infection preventionist? This speaks to me as an infection preventionist. So here's some answers we put together for you. One, Mountain Pacific has a nice infection preventionist checklist that it helps outline the basics, where to start, who to be in contact with, reporting and compliance information, and all these kind of things. We are currently updating it, and the updated version should be out and available soon to reshare with you all. Also, all of our infection preventionists in each of our states around the region have a listserv, and all of our IP should engage with that listserv. It's a great place to share information, find out about infection prevention and control, education and offerings, and the latest and greatest. So if your IP is not on a listserv, make sure that they reach out to us. We will get them connected with the listserv. And then also each of our states have group calls that they're live and active with our infection preventionists. So if you're interested, please share in the chat your contact information. We will make sure to get you added. So, and then of course you can always contact your Mountain Pacific account manager so that we can assist you with those things and align you with all the resources that you need to get off to a great start as an infection preventionist. So, okay, next slide, please. We're going to transition to our learning topic for the week. And I'm sorry because I am going to continue talking for a couple minutes. But today's topic, we're going to be exploring our Transitions of Care Toolkit. And Liam Hedinger, who's one of our data scientists at Mountain Pacific, is going to be sharing and also going to be going through the specifics of the tool itself in detail. And then I'm going to go ahead and start off with just some basic information on what the toolkit is and what its value is. And then Liam will continue. Next slide, please. Okay, so first of all, as we talk about a Transitions of Care toolkit, why is this needed? What is Transitions of Care? So we have to think about transitions of care as our patients or our residents moving from one setting to another in the healthcare system. That might be from our long-term cares to an emergency room, might mean from a hospital back to a long-term care. So as they move to that systems of care, that's really what we mean. And specifically, we're looking at like admissions and readmissions into those areas. So a toolkit was designed kind of in an Excel format that was initially developed in Montana with partners working together, and that included Mountain Pacific. And it was based on kind of an idea that initially came from the Agency for Healthcare Research and Quality, and HRSA supported that. And that was a few years ago, I think back in 2020, if I'm not mistaken. So recently this year, Mountain Pacific got together, some of our team, and updated that toolkit, and we are putting it out again on our website for you guys to utilize. Next slide, please. So what use could this be to you in your setting? It really utilizes a simple data entry tool. So it's, you put it on an Excel line for a particular resident, and it gives you a method to track and analyze data. You can look at admissions and readmissions, your lengths of stay, your diagnoses, even insurance, your follow-up data, like are your residents getting seen? Do they get a primary care follow-up after they've been admitted? All these kind of things. And it looks at preventable readmissions. Next slide, please. Okay, so, it does assist in identifying opportunities for improvement and collaboration with other healthcare settings. You can share graphs. So if you enter the data, and Liam will be demonstrating this in just a moment, but you'll be able to populate data into graphs. Those are great for your coffee meetings, maybe your leadership, sharing with your other healthcare settings. It's great evidence to say, hey, we noticed that on average in America, we keep somebody with a hip fracture in the hospital for a period of 5 days, but you guys are discharging these patients in 3 days back to us. And it kind of gives you a visual way to relate that data. So as you're sharing and you're trying to advocate for the best care possible for your residents, this is a nice tool to be able to pull some of that information together. So other than belaboring a lot of this, Liam has some really good specifics to talk to you about the toolkit, and we'll be demonstrating it live for you. So I'm going to go ahead and turn the time over to Liam as he shares a little more about our toolkit. Thank you, Liam.
Yeah. If you go to the next slide, that'd be great. So the first thing is where to get the toolkit. So the toolkit's on our Mountain Pacific website. You can just go to our Mountain Pacific website, go to Quality Improvement Tools and Resources, which is in the yellow banner there. Click Community Partners in the drop-down menu, and then Community Partner Tools, and then there should be a Transition and Care Toolkit there as well. You can also just go straight to the toolkit by using that link below. And I will drop that in the chat for you guys so you can copy and paste it if you're wanting. All right, just dropped in the chat. So that's where you can access the toolkit. And then the next slide here, I'll show you kind of how to use the toolkit and everything like that. So I'll share my screen here. Awesome. So this is what it looks like when we go to that URL that I dropped in chat there. We will be taken to a page that looks like this. We want to gather information on who's using the toolkit. It kind of inspires us to make more of these type of toolkits if we have a lot of people signing up and using this. So please enter your name and your email, and then if you would like your facility or organization that you work with. Once you press send, a box will come up here that allows you to download the toolkit. The toolkit is going to be an Excel file, and it will look like this. So this is kind of our introductory page. Lori kind of went over this, but this is a great toolkit for hospitals, long-term care facilities, home health facilities, rehabilitation facilities, and I imagine a lot of other facilities as well. It really is a great use to track readmissions, kind of find things that you're doing really well in, as well as maybe areas of improvement. Being able to identify those, this toolkit will help with that. So the first section that we have is the data entry section. We have a couple of demo data entries here. You can feel free to delete these or keep them there. They will add to your graphs. So I would advise actually deleting them. I think that's a better way. But you'll enter each of your patient information in here. This ID section is a way that you can keep track of your patients. The way we've chosen to do it here is just by a number ID. You could enter a name or something like that. The reason we use numbers in this situation is just protect people's information. Once you enter in the data, you will be given, it'll start a new line and start updating the graphs. Some of these boxes are just free entry. So let's do Dr. Pete. While some of these other boxes, sorry, I modified mine a little bit before. Are going to be drop-down menus that you can select from. So for example, the age, you can select from these age bracket categories. As you fill in these sections, this blue section is meant for the initial admission. So you'll fill in all of the information about the initial admission, whether that's in your nursing home setting or in a hospital setting or whatever setting you may have. The initial information section will be filled out in this darker blue. Some of these boxes will auto-populate. The auto-populated boxes are going to be highlighted in yellow. So no need to change those numbers that are in the yellow, but anything in the white space, you can add data to update the graphs and everything like that. The next data entry section we have is the readmission section. This, you can enter data about the readmission. So when they're readmitted, it gives you the number of days between discharge and readmission, which is auto-populated. As you can see, since it's in yellow, you get some information about the ICD-10 codes and so on with that. I think some of these sections at the end here are really important. Keeping track of preventable readmissions and as well as readmissions of the same cause or a different cause are important. Then the last section here is kind of some questions to about the transition of care. We have few questions here that keep track and keep kind of maybe identify areas of improvement or things that you're doing well within your facility, as well as ED visits in the last month. Once you enter in all of this data, you can go over to this initial admissions, readmission evaluation, and follow-up evaluation section to get different graphs of this data. So, however, one thing to point out is that these graphs do not automatically update. Once you've entered the data and you want to see these graphs populate, you should go to the data tab up here and click this refresh button right here. There is instructions right here in the top that give you an idea of how to do that if you do forget in the future, but it's just this green circle there, and that'll update these graphs. See, as you can see, Dr. Pete got in there twice now. So this gives you information on the initial admission. Some of these sections might get really cluttered with data, such as like an ICD-10 code as you're going along. And so you are able to filter these codes. In the bottom left here is a filter button. And so if you just wanted to look at, okay, how are we doing in H10 compared to H15 ICD-10 code, we can get a comparison there between the two codes. You can always press select all to get back to the original graph that we had as well. The same kind of concept follows up for the readmission evaluation. We have information on the readmission day of the week, the readmission discharge disposition, and so on, so on. That same filtering capability can be used on the readmission section as well. And this will help you get an idea of how different trends in your readmissions are going. Lastly, for the graphs, we have the follow-up evaluation. So these are going to be those questions that were asked at the end of the data entry form. These graphs can kind of give you an idea of different trends and different things that are going on in your facility, similar to the previous ones. But I think a lot of these are important questions to be asking and to be keeping track of as you're handling transition and care in your facilities. If you are not into looking at graphs so much, in these next few pages are tables of the same information. So here we have the age, count of age for the admissions, and you get all this different information in a table form. And you can scroll over to the right to see more of that information. The readmission has those same tables, as well as the evaluation pivot tables follow that same format. So I think overall, it's a fairly easy tool to use, that data entry form. As soon as you press refresh, all of these other tabs should be able to update. And I think it's a really great tool for keeping track of your transition of cares and so on. There are some, on this table of contents page, there are some additional resources that could be helpful to you as well. We have additional resources on the Mountain Pacific page, which I don't know if you saw, but is in this row 7. Under additional resources, and it'll take you to the Mountain Pacific care coordination tool and resources. And there's lots of different things on here as well. And then if you're interested, as Lori mentioned, this tool was inspired from a tool made in 2020. So if you're interested about what is in that tool, in row 19 is a link to where you can access that tool. Just right here. There's also a lot of other great information here as well. We got different credits and citations and things, and it should give you kind of great resources to track your transition and care within your facilities. I will stop sharing there.
Thanks for that. Did we have any questions? Looks like Sabrina did have a question for you. It says, do you need to refresh all on each individual tab, or does it update all tabs when clicked?
So yeah, I'll go back to that. If you do press refresh all, it will refresh all of the tabs. If you do refresh isn't available right now, but if you do press refresh, it sometimes will just update that current page. So make sure you're pressing this refresh all, or this big button up above it will refresh all the pages. So you will not need to refresh it on each one of those pages.
Great. Do we have any other questions for our presenters today? Doesn't look
Maureen,
like.
I don't see any questions, but I will just add a follow-up now that Liam has demonstrated this tool. You know, it's really nice when we can get something that's already put together, that's simple and ready to use, but has such great effectiveness. And I think this tool is one of those things, especially when you're looking at things like admissions and readmissions. So I would encourage each of you to download the tool, evaluate whether it might be useful for you. I love it that I can put in data, just simple information. Patient A went to the hospital on Wednesday, got out on Sunday, and yada, yada. And then look over at the graph pages and say, oh my goodness, why, why are 30% of my people who are getting admitted, getting readmitted within 30 days, and drilling down on some of that data because you've put it in. And so I think that's really useful in a simple methodology. So I hope that you guys find it useful too, as you're working with your partners in other healthcare settings, as well, your hospitals and emergency rooms or urgent cares and different sites. So yeah, I would just encourage you guys to use it. Thank you again for letting us share it with you today.
Laura, it looks like we had another question in the chat, and it says, will we be able to download this after the meeting, or do we need to do it now?
Oh, that's a great question. Yeah, it is up on our website, and I believe Liam put a link to it in chat. So it is permanently on our website, so you don't need to worry about doing it at this second, but it is there. So if you don't happen to catch the link from chat today, just go to our Mountain Pacific Quality Health website and find the link for it there, and you can download it at any time. And then, yes, the graphs can be printed. So you can copy paste them into another document. You can print a page at a time. If you want to print all of the graphs at once, I believe that's right, Liam. I don't know if you have any more direction on that. But someone had asked me just directly about that, if the graphs can be printed and all set to go. So.
Yes, so the graphs can be printed. And if you have trouble with that, definitely feel free to reach out to us. But they should be able to be printed individually or as a set of 2 or 3 or all of them at once if you would like.
Okay, and we just want to remind you that Mary did pop the link to our evaluation into the chat. So if you guys could fill that out for us, we really appreciate your feedback. It doesn't look like we have any more questions coming in. So we can go to the next slide, Mary. Okay, looks like we're actually going to finish on time today. So that's amazing for us, considering that we run over by a couple minutes usually each time. But we want to thank you all for joining us this week. And we look forward to seeing you next week on June 21st with a new topic. Lori, actually next week, is that, what is the topic that we're covering? I know you're excited about that.
I am so excited about it because this summer we in patient safety have been focusing on food because we know that keeping people, preventing malnutrition will decrease the risk of sepsis. So next week, we're going to be talking about food. We have a registered dietitian from Hawaii named Darcy Ho that's going to be sharing with us about the liberalizations of diets so that we're able to offer food that are appetizing and appealing and our residents are able to eat, thus keeping up their nutritional status. So I'm so excited about that. I mean, food's always a fun topic, right?
Sorry, I didn't mean to put you on the spot there, Lori.
That's quite all right. Yeah, it's a great topic.
Put your plug in for next week.
Yep. And Jolene made a comment in the chat about that too. So, yep.
Great. Well, thank you everybody for joining us, and we will see you back next week. Thank you.